that feel?
Feels
Your
different.
head's still attached.
I recently put out a video about my thoughts on chiropractic medicine and received a lot of pushback from that video. So I decided to take it upon myself to visit a chiropractor myself to learn firsthand about chiropractic medicine and show you guys what it's like to be a chiropractor. You guys gonna check me out? All right, so we are here with Dr. Yates, who is a chiropractor here in Irving, Texas. Dr. Yates, how are you doing?
I'm doing great. Nice to meet you.
Absolutely. Thank you for having me today.
You're welcome.
Can you tell the viewers out there who you are and kind of what you do?
Sure. My name is Dr. Marilyn Yates, and I actually have a bachelor's degree in science, chemistry, and biology from Westchester University in Pennsylvania. And then in '96, I came to Dallas and ended up getting a Doctor of Chiropractic diploma from Parker University in 2000. So I've been a chiropractor for about 18 years now, and I love it. Well, basically what a chiropractor is we're a healthcare profession that works on patients that usually suffer from soft tissue injuries such as musculoskeletal system or nervous system, and we do all drug-free, hands-on manual therapies to help alleviate the restrictions from the muscles and get some more mobility in the joints.
So excellent. As a spine surgeon, I'm always looking for ways to minimize a patient going to surgery. So whether that's physical therapy, acupuncture, chiropractic medicine, occupational therapy, I'm always looking for ways or different avenues for patients to seek care before surgery. And from what I understand, chiropractic medicine is a great way to exhaust everything that we can before surgery.
Yeah, it sure is. It's an excellent source because not only do we perform chiropractic adjustments here, as I mentioned, the manual adjustments, but we also offer passive therapy modalities such as EMS, electrical stim, and then we also do active rehab, as you can see in here too. And I personally also do a lot of deep tissue myofascial release as well in the patient, so they get a good, well-rounded program, and then I give them a lot of nutritional advice as well for home.
Excellent. So it's a collaboration between surgeons, between intensivists, and as a surgeon, I'm always looking to exhaust all non-operative measures before going to surgery, and I think this is an excellent, route to take before surgery.
Definitely, and vice versa, we work with surgeons as well. And we do the same. So if for some reason the patient is still not quite at 90 or 100%, then we'll work with a surgeon, refer them out, and we just basically work together to get the best care for the patients.
How long is the schooling for?
Nowadays the schooling is about 4 years. Prior to getting into chiropractic school, you do want to check with each school, but on average it takes about 90 credit hours of the basic sciences to get in. And then after that, we do have to take 4 board exams to graduate. And then depending on the state, you want to check with the state board. You do have to take a jurisprudence exam as well to practice and own the license to practice in your state.
And after all of that training, you become a doctor?
Correct,
Excellent.
Yes. So you graduate in school as a doctor, but then to practice as a chiropractor, you do need to pass the jurisprudence and the board exams.
So what is a typical day for you as a chiropractor?
Basically, the clinic here, we open at 9 in the morning, and we have an hour lunch, so we're closed from 1 to 2, and then we're open again from 2 to 7. So Monday through Thursdays, and then on Friday, we're half a day. On average, I see about 25, 30 patients a day, so it's quite a bit.
Wow.
So it gets pretty hectic, and then on Fridays it's a little bit lighter since it's just half a day. Yeah.
Okay. How much can a chiropractor expect to make?
It ranges. I know here in Texas, the average associate that comes in, it's about $48,000 to $50,000, and then if you own your own practice, it's pretty much endless as a business owner, and so you can make anywhere from $102,000 to $200,000.
Another thing that's been really popular in terms of my channel and viewers and questions is adjustments, chiropractic adjustments. I'm a little nervous now.
All right, don't be nervous. I'm going to loosen you up first. I'm going to do a little massage, check your hips and your leg length, and then we'll get you adjusted, okay?
There's some people that don't really believe in the adjustments and other aspects of chiropractic medicine.
So let's see what we got here. I'm gonna push down on your pelvis. So you're a little restricted right in here. Your hips are also rotated to the left.
I wanted to hear your thoughts, adjustments, like what are they and who should get them, and when do you do adjustments?
That's a good question. So basically an adjustment is we're trying to alleviate the restrictions in the muscle tissue. So I'm just kind of decompress you a little bit. So I'm just kind of opening up your joints right here. Or it's called hypotonicity by using a hands-on. So the word chiropractor comes from the Greek language, chiro meaning hands and practo done, so done by hands. So we try to do the spinal manipulations or chiropractic adjustments by moving the joint, getting more joint motion in there, way all the way up. I like to get you guys loosened up before I adjust you because it'll make it a lot easier for me to move the joints that way. Then when that occurs, then the muscles will start to relax and you get more blood flow, more nerve flow into the rest of the extremities and the legs and so forth. A lot of times when patients receive a spinal adjustment or a chiropractic adjustment, they'll feel better right away because they had so much restriction in them. We're all done with the exam.
All right.
Come on up. And as we alleviate that restriction, the endorphins get kicked in, so they also feel a little elated, especially in the neck adjustments. And so that usually will last about an hour or two if it's their first time. And so patients will have to come back for me to reassess them, and then we perform the adjustments again. And so it'll take about 5 to 8 visits before they start noticing a great change and the muscles start calming down and they get more motion in them.
I get this question a lot too in terms of popping your knuckles, cracking your knuckles. Is it okay to crack your knuckles?
No, and well, yes and no. Let me rephrase that. You want to extend the joint because everything we want to do, we want to lengthen. Okay. So if you do this, you're constricting the joints, and so you're actually causing or accelerating the arthritis in the joints. So you want to open. Also, we don't like patients to do this because that's usually a sign that they're tight and they probably need to come in. So great chiropractic patients, especially here, are motor vehicle accident patients because they have a lot of soft tissue injuries. But we also treat athletes. They're one of the best. A lot of professional athletes have a chiropractor they go to all the time to help loosen up the muscles and get more joint motion so they can be at their optimum performance.
And we spoke about utilizing all non-operative measures before a patient comes to see me for surgery. And before I send patients to a chiropractor for adjustments or for any type of treatment, I wanted to experience it and see what they're going through. So I actually wanted to try an adjustment today.
Awesome. I'm looking forward to it.
All right, let's do it.
Now recheck your legs. That's a lot better. Your heels are already leveling out, so that's good. So your hips are already starting to balance out. You're gonna feel me push and you're gonna hear the table drop. So I'm gonna come around and get the table set to your weight. Any pain? Good. 2 more. I'm also gonna adjust your sacrum right here. We're gonna tuck you underneath to open up that L5, S1 joint. Tight right in here. Do you feel that restriction? So I'm gonna adjust right this about T2, T3 area right here. I'm gonna tilt your head to the left. How'd that feel?
Feels different.
Your head's still attached.
Yeah, it is.
All right, you're gonna give me a deep breath in and out. On the out, I'm coming down with you. There we go. You okay? All right, you're just real vocal, huh? Let's flip over on your back for me. We're gonna stretch your neck out a little bit. Any pain or strain doing this? Good. Tight one there and right there. So we're gonna start with the right side. So I'm gonna tilt your head and I'm just gonna give you a little tug. It already went. Did you feel it? Yeah.
Oh.
And then there we go. We just finished it off. One more. Right in here. Same thing. I'm going to tilt your head and just apply a little gentle force in it. I'm going to give you a little decompression. feeling so far? We're done.
So I just received my first adjustment, and thank you, Dr. Yates, for that. It actually wasn't too bad. I was expecting it to hurt a lot more, because I know in surgery we spend a lot of time like this right here, 6 to 10 hours sometimes in surgery. By the end of the case, my neck hurts, my lower back hurts, and I think it went well. What should I expect after this adjustment? Will I need another one, or how does that work?
Yes, usually you do, because on the first time you're going to feel good only for a couple hours, and then because your muscles have a memory, they're going to retract back to their old habits. So each time I work on you, we're going to change that pattern, and then eventually after about 4 to 6 sessions, the body should start calming down. So tonight I want you to go ahead and drink plenty of water to flush out the toxins that we released, and then ice it down if it's a little sore as well.
Okay, and do you believe that prevention is key? Like some of the things that you were teaching me today, should I do these things at home to prevent further injury and, further things from happening to me?
That's right. That's correct. So stretch, we talked about some light stretching exercises for home, and then of course some postural things too that you want to do. Since you look down a lot, you might want to take some breaks whenever you get a chance and do some shoulder rolls as well.
All right. Thank you so much.